Think back to a time you felt, well, completely lost, maybe after a big change or a setback, something that just really knocked the wind out of you.
Yeah,
Now, imagine that feeling, but just amplified by a really profound loss. It's so disorienting, overwhelming.
definitely.
But what if we could understand that disorientation a bit better? Not to make it magically disappear, but maybe just to recognize the landmarks of grief.
A roadmap almost.
Exactly. That's what we're trying to do in our deep dive today. We've pulled together some really comprehensive notes, focusing specifically on the bereaved individual.
Right.
And our goal is really to unpack the complexities of loss and grief in a way that gives you clarity and, really importantly, some actionable insights for you as future nurses.
Precisely. We're looking at, the whole picture, from the basic concepts right through to how grief looks across different cultures.
Yep.
We'll explore different ways people think about the grieving process, how long it might last, the different types of grief you might see.
And how it changes depending on age.
Yeah, how it changes throughout life, and then really critically, how you as nurses can effectively support people going through it.
Right.
And we'll also touch on hospice and advanced directives, which are so important in end-of-life care.
Yeah, absolutely. So this isn't just theory, right? It's about building a practical framework, something you can actually use in your careers to give really empathetic, effective care.
That's the goal.
So let's start with the basics, those core concepts we hear thrown around. Loss, grief, mourning, bereavement. It's easy to kind of mush them together,
It really is.
but there are some key differences, aren't there? Okay, so what is the fundamental difference? Let's break it down.
Well, loss, at its core, it's just the separation from something that has personal value.
Okay.
And it's much broader than just death. It could be losing your health, your independence, even a dream you had.
Right. Things you take for granted sometimes.
Exactly. Then grief is the internal reaction to that loss. It's the whole messy mix. The mental, emotional, social, even the physical stuff we feel inside.
The internal storm, kind of?
That's a good way to put it. And it's amazing how varied it can be, depending on what the loss actually was.
Okay, so grief is the inside experience. What about mourning then? How does that fit in?
Mourning is how we show that grief on the outside. It's shaped heavily by, our culture, our religion, our personal ways of doing things.
Like funerals and rituals?
Yeah, exactly. Funerals, memorial services, wearing certain clothes, specific customs. It's how we publicly acknowledge the loss and get support from others. It's the social part of processing grief.
Got it. And bereavement, that's the umbrella term.
Pretty much. Bereavement is the whole period after a loss. It covers both the inner feeling, the grief, and the outer expression, the mourning. It's the entire journey of adjusting.
Okay.
And knowing these differences really helps us tune into what someone specifically needs when they're bereaved.
That clarity is helpful. Okay, so moving on, our notes get into several theoretical perspectives on grief. Why do we even have different models? What's the point?
Well, think of them like different lenses. They help us understand what can feel like a really chaotic, unpredictable landscape. They give us frameworks, maybe suggesting some common emotional or behavioral patterns we might see. But, and this is really important, they're not rigid rules. They're just guides. Everyone's grief is unique.
Right, not a one-size-fits-all map.
Yeah.
Okay, so let's touch on some of these guides. Kubler-Ross denial, anger, bargaining, depression, acceptance. That's probably the one most people have heard of.
It definitely is.
What's a key thing for us as future nurses to remember about that model?
Okay, the really critical piece about Kubler-Ross is that her work initially came from talking to people who are facing their own death.
Oh, right. Not necessarily someone grieving a loss.
Exactly. Now, the emotions she described, denial, anger,
Yeah.
absolutely common in grief too. But it's not some neat linear ladder you climb.
You don't just tick off the boxes.
No. And not everyone feels all of them or in that order. So for you as nurses, recognizing that nonlinearity is vital. Someone might seem accepting one day and then feel furious the next. That's okay. That's normal for their process.
That's a really important distinction. It's not a checklist.
Yeah.
Okay, then there's Bowlby's model. That one draws on attachment theory.
Yes. Bowlby focused on what happens when those strong attachment bonds are broken by loss.
Okay.
His stages, numbness, disequilibrium, disorganization, and reorganization, they highlight more of the behavioral side of things.
How so?
Well, initially, there might be shock, that numbness. Then comes a period of intense yearning, searching for the person who's gone.
Disequilibrium.
Right, which leads to disorganization as the reality sinks in. Then eventually the person starts to adapt to reorganize their life around the absence. It really shows how deeply our attachments affect how we grieve.
In Engel's model, that
Right.
one looks at psychological reactions over time. Shock, awareness, recovery.
Yeah, Engel's model emphasizes the psychological sort of work involved in adapting. Yeah, like the restitution stage he talks about. That's where the person tries to deal with the loss, maybe through memorial activities or making changes in their life. It highlights the active effort needed to integrate the loss.
Interesting. And finally, Worden's tasks of mourning. That sounds more, well, active, like things you do.
It really is. Worden talks about 4 tasks. First, accept the reality of the loss. Second, process the pain, really feel it. Third, adjust to a world without the person. And fourth, find an enduring connection with them while still moving forward.
Okay, those sound quite practical.
They are. And this model is super helpful for nursing because it gives you concrete areas to focus on when offering support, like helping someone acknowledge the finality or just providing a safe space to talk about the pain.
So it seems the big takeaway from all these models is they offer insights, potential patterns, but grief is intensely personal. Our job is to understand these possibilities without forcing anyone into a box.
Precisely.
Now, a huge question people always have is about the timeline. How long does grief actually last?
Oh, that's the million-dollar question, isn't it? And there's just no single answer.
Right.
We often talk about acute grief, that really intense period right after the loss. That
Yeah.
might be, say, 6 to 8 weeks, maybe longer, especially for older adults, or if the bond was incredibly strong,
Okay, 6 to 8 weeks for the most intense bit, potentially.
potentially. But the whole process of really integrating the loss, finding a new normal,
Hmm.
that can take months,
Mhm.
honestly, sometimes years.
Months to years. Wow. And our notes mention that grief can kind of resurface unexpectedly. Why does that happen?
Yeah, because grief isn't like climbing a hill where you reach the top and you're done.
Mm-hmm.
Significant dates, anniversaries, birthdays, holidays, they can act like triggers, bringing those feelings back, sometimes quite strongly, even years later.
Little emotional landmines.
Kind of. They're powerful reminders. And it's also really important to be aware of unresolved grief. That's when the process gets stuck somehow, which can lead to more complicated reactions down the line.
Okay, that makes sense. Which brings us nicely to the different ways grief can actually show up.
Mhm.
We have normal grief, but like we said, normal feels like such a tricky word here.
It really does. Every grief is normal for that person.
Yeah.
But generally speaking, with what we often call typical or normal grief, people usually manage to keep a fairly stable sense of their own self-worth, even through the pain.
Okay.
They'll feel a whole range of emotions, mostly painful, but maybe sometimes even positive moments sneak in. And usually they can still connect with others even if they need time alone. And over time, gradually, the intensity starts to lessen.
So there's a general trend towards adapting eventually.
Yeah.
Okay, then there's anticipatory grief. That happens before the loss.
Exactly. Like when someone has a terminal illness and you know the loss is coming.
Right.
People might start feeling sadness, anger, fear, all those grief emotions before the person actually passes away.
Does that help in a way?
Sometimes. That anticipatory period can give people a chance to say goodbye, maybe resolve old issues, make practical plans, and sometimes that can make the adjustment after the actual death a little bit easier. But not always.
Okay. Now let's talk about maladaptive grief, or complicated grief. This is where things seem to go off track.
Yeah, this is when the grief is so intense or lasts so long that it really gets in the way of the person's ability to function day to day.
And it can look different ways.
It can. There's delayed grief, where the person sort of pushes it down, consciously or not, and then it erupts later, sometimes really intensely.
Okay. What about distorted or exaggerated grief?
That's when the reactions are just overwhelming, maybe way out of proportion and go on for a long time. It can often tip over into serious mental health issues like clinical depression.
Right.
And then there's chronic or prolonged grief. That's where someone stays intensely focused on the loss for a really extended period, maybe engaging in the same rituals over and over, and they just seem stuck, unable to move forward or re-engage with life.
Our notes pointed out something specific about maladaptive grief. Low self-esteem. Why is that such an important sign?
That's a really key differentiator. In typical grief, even when you feel awful, your basic sense of I'm an okay person usually stays mostly intact. But with maladaptive grief, especially if there are strong feelings of guilt or self-blame or worthlessness that just won't let go, it can really eat away at someone's self-esteem.
And that makes it harder to cope.
Absolutely, it becomes a vicious cycle. The low self-esteem makes it harder to cope, which makes the grief worse, which lowers self-esteem further. Seeing that persistent low self-esteem is a real red flag that the person is having significant trouble processing the loss.
That's a critical distinction for us to watch for when we're assessing people. Okay, shifting gears slightly, we know grief isn't the same at different ages. How might a young child's grief look different from an adult's?
Oh, hugely different. It really depends on their cognitive and emotional development. Very young kids, say under 5, they often don't grasp that death is permanent. They might use magical thinking, like believing the person will just come back. Their grief might show up as behavior changes, like being extra clingy or suddenly wetting the bed again, regressing a bit.
So the whole forever idea just isn't there yet.
Not really. Then school-age kids, they start to understand permanence better, but they might struggle to talk about their feelings.
So how does it come out?
Often physically.
Hmm.
Stomach aches, headaches, trouble sleeping, or maybe they become more irritable, aggressive, have problems at school.
Okay. And teenagers.
Adolescents are already dealing with so much identity, hormones, peer pressure. Grief can get tangled up in all that. You might see acting out, withdrawal from friends and family, maybe risk-taking behaviors.
It's complex at every stage, just in different ways. How about grief in adulthood?
Well, for adults, it's often shaped by a whole mix of things. Previous experiences with loss, their cultural background, spiritual beliefs, how close they were to the person, their usual coping styles.
Life experience plays a bigger role.
Definitely. Adults usually experience that wide range of emotional, cognitive, physical responses we talked about, but it's often filtered through their existing roles and responsibilities too.
And older adults, we mentioned bereavement overload before. What else is important for that group?
Older adults are, unfortunately, more likely to face multiple losses closer together: spouses, friends, siblings, even loss of physical abilities. That's the bereavement overload.
Which must be incredibly difficult.
It really is. They might also have more complicated grief reactions because of existing health problems, maybe smaller social circles, or just the sheer weight of cumulative grief from earlier losses.
Yeah.
And losing a spouse in later life is particularly tough. It carries a higher risk of depression, isolation, and even physical health worsening.
It really drives home how crucial it is to consider someone's life stage when we're trying to understand their grief. And culture, too, that shapes things profoundly, doesn't it?
Massively. Culture dictates so much: the rituals we perform, how long we're supposed to mourn, how openly we express emotions, where we turn for comfort. These practices give us a shared script, a framework for navigating grief within our community.
So what happens if someone can't follow those cultural scripts? Maybe they're in a different country or their family doesn't adhere to traditions.
That can really complicate things. If you can't participate in the rituals you expect, or if you're in a place where nobody understands or respects your cultural ways of grieving.
You feel really alone.
Exactly. You might feel disenfranchised, like your grief isn't valid or seen, and that can seriously get in the way of healing.
So for us as nurses,
It's absolutely vital to be aware of and sensitive to the huge diversity in cultural practices around death and mourning. You have to ask. You have to be open. Are notes mentioned assessing these practices? Maybe using a tool like the one referenced, Box 3601. We don't have the box itself, but the point is clear. We need to do that culturally informed assessment.
cultural humility is key. Okay, let's bring on this knowledge into practice. The nursing process for someone who's grieving. How do we approach this systematically?
Right. The nursing process gives us that structure. First up is assessment, gathering all that info. What was the loss? How are they reacting emotionally, physically? What are their usual coping skills? Who's their support system? What are their cultural and spiritual beliefs?
The whole picture.
The whole picture. And paying special attention to those risk factors for complicated grief. Multiple losses, history of depression or anxiety, not much support, maybe being really dependent on the person who died, and always factoring in their developmental stage.
Okay, so a really thorough, personalized assessment first. Based on that, what kind of nursing diagnoses might we consider?
Well, you might identify risk for complicated grieving if those risk factors are present, or maybe spiritual distress if the loss has shaken their faith, social isolation if they're pulling away from everyone. It really depends on what you find in the assessment.
And what are we aiming for? What do positive outcomes look like? How do we know our support is helping?
Good outcomes would be things like the person is able to talk about the loss, maybe identify where they are in their grief process and see it as a process. They might start participating in rituals or support groups that are meaningful to them. You look for signs they're gradually moving towards adapting to life after the loss, maybe forming new connections or setting small goals.
Okay, that makes sense. Now the doing part. planning and interventions, what are some key things nurses can actually do to support someone grieving?
Interventions always need to be tailored, of course, but some core actions include encouraging them to talk about the loss. If they're ready, creating that safe, non-judgmental space is huge.
Just listening.
Just listening, validating their feelings. You can help them understand their emotions by gently relating them to grief models, not to label, but to normalize their experience. Help them brainstorm healthy coping strategies.
Mm,
Journaling, walking, music, whatever works for them.
practical things.
Practical things. And facilitating connection, encouraging them to reach out to supportive friends, family, or maybe suggesting a support group. Providing education about grief, what to expect, can also be really empowering, and always respecting their spiritual and cultural needs.
So it's a mix of support, education, practical help, and facilitating their own coping. Okay, finally, evaluation. How do we know if what we're doing is working? What questions should we ask ourselves?
Evaluation means checking back on those outcomes.
Yeah.
Has the person acknowledged the reality of the loss? Or are they able to express a wider range of feelings now, maybe not just intense pain, but memories too, both good and bad?
Mm-hmm.
Have they started tentatively re-engaging with life, social activities, spiritual practices, things that used to matter to them? Are they beginning to think about the future, even in small ways, setting new goals or strengthening other relationships? Those are all positive signs.
That gives us a really clear path for our role. Our notes also briefly mention hospice and advanced directives. How do they fit into this whole picture of loss and grief?
They're incredibly important. Hospice care isn't just about managing physical symptoms for someone terminally ill. It's holistic care for the patient and their family.
Right, emotional and spiritual support too.
Absolutely. And that support often extends to bereavement care for the family after the person has died, which directly ties into everything we've been discussing.
And advanced directives.
Advanced directives like living wills or appointing a healthcare power of attorney let people make their wishes known about end-of-life care while they still can. This respects their autonomy, their right to choose.
And takes some pressure off the family later.
Exactly. It can ease some of the decision-making burden for grieving families during an already incredibly difficult time.
So both are really about promoting dignity and choice, both at the end of life and during bereavement.
Wow, this has been such a valuable deep dive. If we had to boil it down, what are the absolute must-know takeaways for nursing students listening? I think the most crucial thing is understanding that grief is profoundly personal and incredibly varied. There's no single right way to do it. Your role as a nurse is to offer compassionate, individualized support.
Right.
Base that support on understanding all those influencing factors, their history, culture, age, the specific loss, and develop those skills to recognize the signs of complicated grief and know how to help people find healthy ways to cope.
Absolutely. And maybe a final thought for you as you continue your nursing journey. Take some time to reflect on your own experiences with loss, your own beliefs about grief. How might those shape how you care for others? Think about how you can consciously create that safe, supportive, culturally sensitive space for your future patients and their families when they're navigating one of the hardest human experiences there is. Your empathy, backed by this knowledge, will make such a difference.